Good evening. When we set out the plans for the island's social and economic reconnection on the 5th of March, I said that we'd be making a separate announcement about the future of travel to and from Jersey. Now, I recognise that this is a critical issue for many islanders. There are those who want to be able to visit family or friends in the UK, Europe and further abroad. There are individuals who need to attend to urgent overseas family and business matters in person. And many simply want to be able to take a much-needed break off the rock for their mental and physical well-being. Equally, there are also islanders who will be concerned about the impact that reopening our borders will have on their safety and the prevalence of COVID-19 in our community. This evening, we will be setting out the plans to allow travel to and from our island in a safe and controlled way through the phased reintroduction of our safer travel policy. On the advice of STAC, we've agreed a process that will allow the island to reconnect with the rest of the world following a phased approach and beginning with the UK and other Crown dependencies on Monday, the 26th of April. By waiting until the end of April, this approach will protect our most vulnerable who are reaping the success of our swift and efficient vaccination programme that has given them protection against COVID-19. It is thanks to you that we are enjoying low case rates and are able to continue with our vaccination programme and the reopening of our community in tandem. And by following the travel rules of testing and isolating, it will allow us all to travel and to welcome people to our island in a safe way. I'm now going to ask the Deputy Chief Minister, Senator Lyndon Farnham, to discuss the detail of our travel reconnection plans and what islanders can expect when travelling from the 26th of April. Lyndon.
Thank you, John. As you have said, our safer travel policy will be introduced on Monday, the 26th of April, 2 weeks after stage 5 of the Reconnection strategy. This continues our phased approach of introducing reconnection measures gradually and allowing suitable time to assess their impact on the spread of COVID-19 in our community. From the 26th of April, we will be permitting travel to and from the United Kingdom and the other Crown dependencies only. And we will be using the red, amber, green ratings from our safer travel policy, which was put into place in July last year. All other countries, including Ireland and mainland Europe, will remain under the red designation, requiring 10 days isolation. For the UK and Crown dependencies, travellers arriving in Jersey from April the 26th will have to provide their travel history in advance through our online portal and undertake PCR tests on arrival and on day 5 and day 10 following arrival. Those entering the island from green countries and regions will be required to isolate only until they have received a negative test result from their first test on arrival. Those arriving from amber zones will have to isolate until they have received a day 5 negative test result, and those arriving from red zones will need to isolate until they have a day 10 negative test result. Anyone who receives a positive test will, of course, have to isolate for 14 days, in line with the public health guidance. The United Kingdom will continue to be broken down by local regions for the red, amber, green ratings, which will be kept under weekly review. Travellers must check the rating of their starting location so they know in advance how long they will be required to isolate after arriving in Jersey. The red, amber, green classifications will be reintroduced for travel to Jersey from all other destinations, including Ireland, mainland Europe, and the rest of the world, excluding the restricted jurisdictions, from Monday the 17th of May, which is when the United Kingdom also reintroduces international travel. Not only does the reintroduction of our safer travel policy allow visitors to enjoy our island again, bringing a much-needed lift to our island hotels and restaurants, it also provides islanders a welcome opportunity to travel again. So many of us have felt isolated during the pandemic, even with our friends and family around us. Many of us know that one of the joys of living on an island is the ability to escape it, even if only for a few days. And I believe that this announcement will bring welcome news to those who have been waiting to see family and friends overseas and to travel again for their own well-being. Equally, I hope that this announcement will give confidence to our much valued hospitality industry, which has suffered significantly throughout the COVID-19 pandemic. Officials are in close communication with representatives of our transport providers and our travel operators, and I give them my sincere commitment to continue working with them as they navigate the process of the safe reopening of our island. And this commitment includes looking at the local restrictions we currently have on businesses here in Jersey. And I have always maintained that we must open up our local economy as much as we safely and possibly can before easing our border restrictions. Compliance across the local economy has been excellent, and we see this through our very consistently low number of COVID cases in the community. Ministers have therefore asked STAC for updated advice following their meeting this coming Monday to see if we can relax these further. If we continue to work together, I'm certain that we can get the internal economy back to normal sooner rather than later. And with more and more islanders being vaccinated, and with our most vulnerable islanders being vaccinated with both doses, we will be keeping a very close eye on which metrics are the best signs of success in our battle against COVID-19. And we will use this progress to return to normality as soon as we possibly can. In finishing, I would just like to take this opportunity to remind islanders that our economic support measures remain in place and under constant review to ensure we are providing the necessary support to continue to protect our businesses, jobs and livelihoods throughout the whole duration of the pandemic. Many of the existing schemes are currently guaranteed until the end of April, and I would like to reassure islanders that there will be no cliff edge finish to these measures. Ministers met this morning to discuss how these would be extended, and we will be making an announcement at the end of this month to provide the final details. I'll now hand over to Dr. Adrian Noon, who will provide a short update on the very good ongoing progress of the vaccination programme. Thank you. Adrian.
Thank you, Ministers. We've now administered more than 45,000 doses of vaccine, and 46% of the adult population aged over 18 have received their first dose. 82% of those clinically extremely vulnerable have received their first dose, whilst 84% of the care home residents have received their second dose of the vaccine. This week, we also announced that we will begin phase 2 of the vaccination programme next month, and by the end of May, we still intend to offer a first dose to every islander aged 18 and over. I must always stress that our vaccination supply has been changeable, and we review the supply from the UK on a weekly basis. We have confidence in the supply of vaccine that we continue to receive, and while we may see less delivered during April, this has been part of our planning. If we do receive less doses from the UK in the coming weeks, it will be unlikely to impact on our vaccination schedule, and we remain on track to have opened appointments up to all adults by the end of May. We will make sure that islanders are made aware of any changes to the vaccination supply which could potentially impact on the schedule. We also are confident in the safety of the Oxford AstraZeneca vaccine, following concerns this week about potential risks amongst a very small percentage of those who had been immunised. Jersey has been working closely with our partners in the UK, the Department of Health and Social Care, Public Health England and the Joint Committee on Vaccination and Immunisation. the Medicines and Healthcare Products Regulatory Agency, the MHRA, who are the UK regulators in medicines and vaccines, as well as the World Health Organization and European Medicines Authority, confirmed yesterday that there was no safety concerns with the Oxford AstraZeneca vaccine, and it should continue to be used. It is clear from medical data that the benefit of the vaccine in protecting people far outweighs the risks presented by not being vaccinated against COVID-19. I'd like to thank all islanders for the continued cooperation and your support for the vaccination programme. It's hugely appreciated by all of us and has made the work of our team so much more effective. I will now pass back to the Chief Minister.
Thank you, Lyndon and Dr. Noon. Before I take questions, there are some additional changes that we are making to the current restrictions to ensure that we are treating islanders and community groups as fairly and equally as possible as we can and as we reconnect. The first is a change to faith worship, including marriage and funeral ceremonies, although not, I should emphasise, wedding receptions or wakes. So from Friday the 26th of March, there will be no restriction on the number of people being able to meet indoors for faith worship, as long as 2-metre physical distancing is observed, contact details are taken for tracing purposes, and masks are worn. So this will mean that all faith communities can enjoy the coming period, whether that is the Feast of Passover for the island's Jewish community, the Spring Festival of Holi for our Hindu community, the Easter celebrations for our Christian communities, and for our Muslim community to celebrate Ramadan in April. Secondly, we want to ensure that children are given as much freedom as possible for their physical and mental well-being, whilst remaining safe. So from Friday the 26th of March, all children's indoor activities can allow up to 10 children without physical distancing or contact details needing to be recorded, or an unlimited number of children are permitted as long as 2-metre physical distancing is observed and contact details are taken for tracing purposes. Furthermore, from that date, all children's outdoor activities will be allowed for up to 45 children without physical distancing or contact details needing to be recorded. I hope that these amendments will be welcomed and provide additional freedoms to our community as we continue to see low case numbers in Jersey. We will continue to develop policies around opening up both the internal economy and our external borders over the coming weeks, including easing further restrictions on hospitality, retail and workplaces. For the future, we will then begin to address the issues surrounding proposals for the introduction of vaccination passports, a review of the triple testing process, and an overall review of the safer travel policy, as more islanders are vaccinated and so protected from COVID-19. We are only able to continue making these positive changes if we all continue following the rules and public health guidance, even as we reconnect. So please, I really urge you, continue the good habits that have got us to this place, and I know it can be difficult. And I'd now like to take questions from the media. So, who we've got, hopefully, is, I can't see it, yes, sorry, Harry Booth from 103, Charlie John from the JP, Elodie Rodule from Bailiwick Express, Robert Hall from the BBC, and Gary Burgess from Channel TV. Right, and we'll go in that order. So, Harry.
Thank you and good afternoon. Obviously, Easter is coming up quite shortly. The borders aren't due to properly reopen until obviously a couple of weeks after that. Was any consideration given to maybe opening up to allow people from Jersey to Guernsey to go to each island during that period? I'm assuming that normally during an Easter that's quite popular and that could have really helped both economies.
At the end of the day, we have been considering the position with Guernsey, and certainly Lyndon has referred to it in the past, and that is actually one of the reasons that we're basically being consistent with Guernsey and opening up towards the end of April. And I think the main issue is that unfortunately it's just slightly too early in the context of also then trying to get the other reconnections coming through. As I said, but that is fairly obviously why, with a phased approach, we're doing the CDs, we're doing the Channel Islands, and we're doing the United Kingdom on the date we can. Do you want to add to that?
No, I don't think so.
Okay. All right. Do you want to do a second question?
Yes, thank you very much. So obviously it's just for the UK and Crown dependencies before you move on to other countries. How do you make sure that people, say, travelling from other countries to the UK or find another way to get here, if you get what I mean? Because I suppose you don't want people coming from high COVID jurisdictions and managing to find their way here. In terms of making sure that doesn't happen and really stamping down on that, what can you say?
Well, there are two regimes, if you like. There's the present regime, and to an extent, I suppose what I would say is that risk already exists because people can still come in, but at the moment the rule is that everybody has to isolate for an extensive period. What we're doing is we are going back to the system that served us very well during last year, and so all we're saying is that as we reconnect, that anybody coming from what is rated as a red area, and that's relative to the level of cases that they're having, will be treated in a particular way. But obviously now, particularly as we see vaccination rates in the United Kingdom in the same, we're all in the same place through the very good decisions that were taken on the vaccination programme in the middle of last year, that their numbers are coming down. We are obviously anticipating that they will be going green, and therefore it's right to have that different approach. It's the approach we were running last year with all the mitigations around it. So you've got to have your isolation for your day zero test. You'll be getting your texted message all the time you're here, all those type of things. That was an appropriate time to bring it in. But there are mitigations in place. There are verifications, I think, done on how people are travelling. And all that, but your risks, there is no 100% foolproof system that's going to say that if somebody comes from a banned red country, finds its way into the UK, and then eventually comes down to here, we would hopefully be picking that up through the enforcement process, and that's also been shown to be working pretty well as well. Okay. Charlie.
Thank you, Chief Minister. I was interested to know whether there are any differences between the policy that's been proposed today and what STAC advised earlier this week. For example, did STAC advise that the threshold for green arrivals should be kept at 50 or reduced back to 25 cases per 100,000?
So the majority opinion of STAC was to remain at 50. And if it's helpful, because I know some comparisons have been made, there are other jurisdictions that, for example, are using 30, but that's 30 over 7 days, and we're using 50 over 14 days. Okay. Next question.
And why was a common travel area approach not adopted that included Ireland? What was the kind of situation in Ireland that didn't accommodate that?
Well, the initial factor for the phasing in approach, and just please bear in mind these are never easy decisions to make, was principally taking account of the vaccination rates. And so what we're saying is that obviously we're anticipating that situation will change, but equally then that allows the various rates that we're seeing around Europe to be taken into account as we go further down that line. And we've said it's no sooner than the date in May. Okay.
Thank you.
Elodie.
Good afternoon, Chief Minister.
Oh,
I'm afraid you've got Fiona here rather than
Yes.
Elodie, so sorry about that.
That's okay, don't worry. I've just wrong name written down here. There we go.
We heard from your officials earlier that there will be a review of the viability of the triple test system for arrivals in the summer. How long has the government budgeted to keep providing these tests, and how likely is it that it will become a paid-for service in future?
Didn't pick that.
Thanks, Fiona. I think we're going to need to look at some sort of charging mechanism as in the medium to longer term. I'm not sure we're planning to do that too soon. Of course, the types of test and the accuracy of the tests are improving. The cost of the tests are reducing now. So I think it might be possible to look at that and providing a realistic and affordable charge. If the charge is too high, actually, it will actually be a disincentive to travel. So that's under consideration. No immediate plans, but I think that's likely to be introduced at some stage in the future.
Yeah, and within the consideration for the whole testing, as Lyndon said, we've got the technologies are changing, the costs are coming down. There's also, as we look ahead and as we anticipate what may be requirements even during the rest of this year, maybe even going further afield, is what obviously the very good investment that we put in place during all of last summer is how we then build on that. And so there are some discussions. There's some discussion particularly around how the technology is changing, and those are coming to CAM basically the next short few days actually. But obviously that's for going away, investigating, and then working out the timescales when you're going to implement it. That then sits parallel to if the costs come down, then as Lyndon said, it is more practical or feasible to contemplate charging. I think you'll be finding that's going to be happening across the world as we slowly move out of the kind of pandemic scenario and back to something that's going to resemble some form of normality.
John, can I add something to that? I think it's relevant. Part of the process we're looking at now between now and the borders and the reintroduction of the traffic light scheme is a review of the requirement for triple testing. That's something we're looking at. We're also looking at the immunisation or passport, vaccination passport progress, because we could end up in a system where people with a vaccination passport, whether it be one vaccination or two vaccinations, could well be exempt from some of the testing procedures, for example, as we move forward. So I think we're going to be in a positively changing situation as we move forward.
Okay, second question.
Thank you for those answers. We know that the government has the option of taking shares in Blue Islands after it gave the company a 10 million loan to protect air connectivity. So given the continuing volatility of COVID and the vaccination situation in other jurisdictions and its effects on tourism and airlines, are you now considering taking the option of taking shares in the airline more seriously?
Not at this stage. We don't want to become shareholders in an airline. We provided financial support by way of a loan to ensure we maintain the lifeline services, and Blue Islands have done that very well throughout the pandemic. So we're very much in the position of managing the loan facility with them over the next few years. They have got some exciting plans to develop and grow the airline, and we'll be working with them to achieve that. But there are no plans currently to take shares in the business.
Okay, Robert.
Unmute myself. Thank you. Just a couple of things, really, Chief Minister. Thank you very much for talking to us. The question of the border relaxation is great, but of course people have got to get here, and that obviously begs the question of how we ensure that obviously they now have a date, but the carriers. Can you hear me? Okay.
Yes.
Sorry.
Yes.
Okay. It's a question of how and when the carriers by air and sea will tap into a date that they've now got. What communications, what discussions have you had with them?
Thank you, John. Ports of Jersey are in constant discussions with the airlines. They've been working closely to make sure we have the appropriate routes and connections in place. And actually, over the last few days, some of the key carriers have been proposing some very, very good schedules as we move into the summer. The same, it's not all about air as well. We have Condor ferries providing very important services, not just with passengers but with freight, and so that work is being done now. That's why it's important that we give as much notice as possible, which is why we're making the announcement today. So that gives a number of weeks for the schedules to be finalised. But from what we start with at the 26th of April, will gradually improve as we get into the summer.
Thank you. And my second question is this. there is always the risk that people from areas of the UK that have been heavily restricted for a long time might say, oh, great, let's go down to the Channel Islands and let our hair down. What efforts will be in place to ensure that anybody arriving, once this kicks in, is more than aware of what we expect from them here in Jersey?
So at the very least, we'll be doing the same regime that we were following last year. And I know, and it's not evidential, but it's anecdotal in terms of one of the conferences I was attending on matters to do with COVID. The organiser had referenced either family or friends that had been over in Jersey last year, and they'd said they'd never felt safer, and actually to an extent they'd felt more safe than they had been in the UK. And there are enforcement measures in place. And the examples we use, so that's partially done through all the visits to premises, and that's also around making sure that people are adhering to their isolation when they come over, and there have been various measures being put in place. So there's been, for example, in terms of visits, so to date we've done over 2,000 visits to premises to ensure compliance with legislation, over 1,600 checks conducted on closed licensed premises to ensure that they're actually closed, and there's just been just under 2,000 words of advice issued for breaches of COVID-19 legislation. And there have also been some fines that have been put in place, and I think certainly locally everybody's aware of that. And that will be also communicated when the borders start opening again.
I suppose it's possible that people are watching this on Facebook in the UK. As Chief Minister, on behalf of the government, what would be your message to them in terms of the attitude, if you like, that they should adopt in coming to an island which is currently in a very good place?
I think the main point is that we absolutely welcome you to Jersey, but please respect the rules, and there are penalties if you don't respect the rules. But Jersey's been in a very good, safe place. We work as a community. We welcome you to our community, but please respect the community as well.
Thank you very much.
Okay. Gary.
I thought you were going to add and make sure you spend loads of money when you get here as well. Get that in for good measure. Make the most out of these holiday makers. I'm getting quite a few messages already from the tourism industry who welcome this news, but they need more meat on the bone, particularly around vaccination passports. Because although you've got the traffic light system, if I'm booking my holiday to Jersey, it's still a game of roulette, because it's not within my control as to how bad my neighbourhood is by the time I travel. So my green region might be a red region by the time I go, and my holiday is effectively stuffed, because who wants to isolate for 10 days if you're coming here for less than that? Can you just put more meat on the bones on your ambitions for vaccination passports, certificates of immunity, and so on and so forth? For example, we've got cruise lines will already accept a letter from a GP as proof of 2 vaccines. Given we're small and nimble, we could have first mover advantage. Can you just do something common sense like that?
Lyndon?
Yeah, we've got the economy department has very strong aspirations in terms of maximising the potential from vaccinated persons. I want to be clear, though, we're not going to prohibit people who decide not to have the vaccination. We're not going to discriminate against them. There could just be a different process for people coming in. If you're not vaccinated, you'll be subject to the testing regime, and that will be either on arrival, or you could take a test 72 hours before, and if that's negative, that could exempt you from the isolation period. That's all very tried and tested and safe. But then I would like to see people vaccinated have a different process. So I think there's a great opportunity for islanders to feel safe and confident, because don't forget, by that time, the majority of our islanders will be vaccinated twice, as Adrian's laid out before. We are ahead of the game with that, so we're leading in that. And actually, that should give reassurance for islanders when people come here, because if the majority of us are vaccinated, the risk is considerably reduced. So we should be able to welcome holidaymakers with great confidence. And I very much hope, as I've said before, the on-island restrictions will be significantly reduced by then, so we can all return to some sort of normality this summer. There comes a stage where we have to accept COVID is here to stay and we have to build our lives around it. So yes, vaccination, passports, immunisation certificates, I think are a key opportunity and will play a key part in travel later on this year.
I was just really more timescales. You've already got 6 weeks before traffic lights. Could you get it sorted in the next 6 weeks?
I would like to. STAC are considering that at the moment. It's very high on the agenda. It's a priority, along with the review of the triple testing. So I would like to see that being introduced sooner rather than later, or the option for people vaccinated to take advantage of that. We see British Airways have included some technology now to make people with vaccination passports travelling with that airline much easier. We can link into that with technology. So it is a priority, Gary, and we're going to be working under advice, of course, to introduce that as soon as we possibly can.
And my second question, really, Chief Minister, just to flip the entire tone of this press conference on its head. There will be people for whom you've just put the willies up them with fear at the idea of opening the border because they're terrified of the world. What do you say to people who really don't like this idea of reopening?
Right, there's two sides. One is there has got to come a point in time where we've got to reconnect the island. We can't stay isolated for the rest of the year or forever. We are bringing this in very cautiously. We are doing it. We had long and good discussions with the professionals who advise us, and don't forget that the system that we had in place is robust, and it does work very, very well. So I think the important things there are try not to be afraid. I accept it's going to be concerning because it's something new. But actually our numbers are very, very good. And the whole point, all we're doing is we're reconnecting. So we're not opening the floodgates. What we're saying is that people coming in, if they're coming from an area that is basically green, that's consistent with us, broadly, that they come in and they have a test on day 0, and provided that test is negative, they have to isolate until that test, the results of that test have come through. Provided that's negative, they can then mix in the community, but they are still monitored for that period of time when they're on island. They're monitored through texting, and they sometimes get a phone call as well. And obviously there are more rigorous systems in place for anybody not coming from a green ranked region. So there are systems in place, there is monitoring, and as I said in response to one of the earlier questions, certainly some people whose family or friends experienced it last year actually said that they felt very, very safe over here, and they very much welcomed the restrictions that were in place, or the mitigations that were in place, to make sure that not only did they remain safe, but the community remained safe as well. Okay.
Thank you. Have a good weekend.
Thank you very much. And to you, Gary. I think what we will do, we were going to keep it it is a Friday evening, we're going to keep it fairly short, so I will just sum up, and then we'll draw this to a close. So, I am certain that the reintroduction of our safer travel policy will be welcomed across the island. And we can see it in emails and messages we are getting. And it is a sign that normality is finally beginning to return to Jersey and to our community. So over a year has now passed since the first case was reported in our island. And I'm certain that many of us didn't believe that COVID-19 would have had such a profound effect on us all, or that we would face such challenges and such restrictions in the months that followed. We are all aware that other jurisdictions still face challenges, and we continue to monitor that position pretty well on a daily basis. But here in Jersey, we are in a good position now, one that I believe will mean the end of all restrictions soon, as we move with confidence through our Reconnection strategy. And so this is down to your effort, your response to the challenges we faced, and your support for our community. And it is because of you that we can open our homes safely, open our economy safely, and open our borders safely. And we should all be rightly proud of that. Thank you for listening. Good evening, and have a good weekend.